Welcome to the Kaleidoscope of Possibilities, Alternative Perspectives on Mental Health. My name is Dr. Adriana Popescu. I'm a licensed clinical psychologist and leader in the field of mental health, energy psychology, addiction, trauma, and empowerment. In this podcast, we will be exploring mental health from a variety of perspectives, from the spiritual to the shamanic and beyond. What if mental illness isn't everything we think it is? What if everything we see as a pathology is actually a possibility? What else is possible with mental health? Hi, everyone. Welcome to another episode of Kaleidoscope of Possibilities, Alternative Perspectives on Mental Health. I'm your host, Dr. Adriana Popescu, and I'm really excited today to be speaking with Veronika Gold. Veronika Gold is a co-founder, CEO, therapist, trainer, and consultant at Polaris Insight Center, a San Francisco-based clinic providing ketamine-assisted psychotherapy. She's a sub-investigator and co-therapist in the MAPS clinical program from MDMA-assisted psychotherapy for the treatment of PTSD. Veronika received her MA in clinical psychology from the Charles University in Prague and her MA in integral counseling psychology from the California Institute of Integral Studies. She's a certified EMDR therapist and training facilitator, an organic intelligence expert, and a realization process teacher. Welcome, Veronika.
Thank you for having me. Great to be here.
I can't wait to dive into all these interesting things that you've been doing with your work and this research you've been involved in that is so cutting edge and very exciting. But first, I would love to hear a little bit about your story, how you came to do this work, what drew you to working with the modalities that you're working with.
Yeah, absolutely. So, you've kind of read the long list of things I've done, and I come originally from the Czech Republic. And I studied psychology. I wanted to be a psychologist. And in my teenage years, I got introduced to work of Stanislav Grof, who was a psychiatrist from the Czech Republic, who then lived in the United States, actually here in the Bay Area. And he worked with non-ordinary states of consciousness, and specifically with the research of LSD psychotherapy in the 50s and 60s, and then moved to the United States, worked at the Maryland Research Institute. And when LSD became scheduled medicine, he moved to SLN, where he developed a method of holotropic breathwork together with his first wife, Christina. And this holotropic breathwork has been a method that I was introduced to in my teenage years. And it's a method of breathing, listening to music, and working somatically with the intention of entering into non-ordinary states of consciousness where healing can happen. And so I was studying, I was a psychologist, and then I had a personal passion and interest in working with non-ordinary states of consciousness. And so, fast forward, I moved to the United States in 2003, really following Stan Grof, and then I went to school here to the California Institute of Integral Studies and became a psychotherapist. My interest and specialization became in the treatment of trauma and anxiety disorders. And then about 5 years ago, I got the opportunity to become one of the therapists on the MDMA clinical trials for treatment of PTSD. And so that was kind of the first time, and I was able to combine the two, my passion and interest in working with these expanded states of consciousness and psychotherapy. And working, we started on phase 2, which was an open label study, which means that we knew that the participants we worked with received MDMA. And then we moved to the phase 3 study, which is happening right now, which is a double-blind placebo study. And, I wasn't surprised, but it was just wonderful to see the healing potential of working with the medicine. And we had a couple of colleagues who've been working with the medicine ketamine. And so kind of inspired by their work, I started to work at an infusion clinic where I was developing ketamine-assisted psychotherapy program to go along with the infusions, because that's, we will talk maybe a little bit more about how ketamine therapy looks like, but it's oftentimes delivered through infusion. And from there, I saw some limitations of doing it in that type of setting. We got together with some of my colleagues from MAPS, and we started Polaris Insight Center, where I'm working now, where we provide ketamine-assisted psychotherapy in a little bit different setting, very similar to the protocol that we use at MAPS and the protocol that Stan Grof worked with and developed.
Oh, so amazing. I love Stan Grof. I too found him early on when I was just a freshman in college here in the States, and I was in a psychology class on drugs, psychology of drugs, and I ended up doing a research paper on his work with LSD when he was using it in conjunction with psychotherapy to treat alcoholics. Right. I just found it so fascinating. I could have never imagined that our field would embrace this or even be open to using these strategies again once the drugs were outlawed, and it just became, a non-starter. The idea that we can, there's been this resurgence in the research and people really discovering these therapeutic benefits is just amazing to me.
Yeah, absolutely. When I came here in 2003, really, probably a couple months after my arrival, I met Michael and Annie Midhofers on an event for Stan Grof. And, Michael and Annie are a couple a psychiatrist and a nurse practitioner who've developed the protocol for the MDMA clinical trial. And it was just in the time when they were starting to work with participants. And so they were sharing about it. As that's what they were doing, over there in Charleston, and it seemed like dream was coming true, that it was possible that was happening. And so for me, it was really beautiful, that almost 13 years later to get an invitation to be a therapist on the trial.
Yeah, and I definitely want to find out more about where that's all at, because you guys have come a long way in that study. But first, I want to ask you about, what is it about non-ordinary, like maybe even just describing what is a non-ordinary state of consciousness, and what is it about that state that allows healing to occur?
Mm-hmm. So these states, they have a lot of different names that people use, and that can be, altered state of consciousness, or non-ordinary state, or expanded state of consciousness. And I like the expanded state or the non-ordinary state, that kind of verbiage to use for those states. And those are states that have, there is a shift in our perception, feelings, sensations. There can be amplification of certain aspects of experience, and as well dulling of other aspects of experience. And there are a variety of levels where people can enter. And so, Stan Grof is one of many people, but he did like a great work of describing the different levels where we can enter in these states. And sometimes it's more like an expanded ability to look at biographical material, looking at our story, but maybe with more distance or with more empathy and compassion. But he as well described the perinatal time, the time, from the conception to birth, and really talked about it as such an important time in our life, and oftentimes time when certain behavioral patterns are imprinted. And that's another area where we can enter into in these states. And then there are other levels of archetypal collective consciousness and mystical consciousness, and this universal unity and oneness. So, it can really feel like a spiritual or mystical experience. And, those are states that we can enter as well without, medicines, without drugs. It can be through meditation, breathing, fasting, through something like holotropic breathwork, but even in things like daydreaming or dreaming, lucid dreaming, during sex. So there are times where we enter into these states, and they've been known to facilitate healing and transformation for thousands of years. So, if we look at history of, many cultures, the healing, physical and psychological, has been always connected with non-ordinary states of consciousness. And sometimes it would be the healer, the shaman, the medicine man, the medicine woman entering into an ordinary state of consciousness to facilitate healing for a person. Sometimes it would be the person who needed healing entering into those states. And sometimes it would be a whole group of people entering into that state for healing of a person. So those are states that are, that it's not anything new. It's very familiar and been used, for millennia. And what is it about that facilitates the healing? And so there is this new different perspective, this new different viewpoint that we can have. We have the things that we ordinarily believe can kind of fall apart, and there is this new view of reality that we enter to. And just having those experiences can shift how we look at our psyche, how we look at mental health or mental illness, and how we look at healing. And two main principles that I often talk about, and has been talked about, is the inner healing intelligence, this innate capacity to heal, that in these states, there we get kind of access to our own ability to go where we need to go so that the healing and transformation can happen. So it's almost like a compass that can find where we are stuck. And like we say, the body has the ability to heal. So like, even if you have a flu, maybe you get some medicine that can, put the fever down, or, does something that you don't feel the pain in your throat, but really it's your body that has to heal from within. And so in the same way, in the work with these medicines, we are trying to create this optimal set and setting so this innate healing can happen. So there is this trust in the inner healing intelligence, and then healing through the experience that really we don't, sometimes we continue to process, and we, continue to understand, but sometimes the insight, the shift can happen through that non-ordinary state of consciousness. So those are some of the ways how these states can be helpful in psychotherapy.
Yeah, my experience with all kinds of different altered states of consciousness generally has been that my ego, my mind in particular, is no longer the dominant. We tend to be, especially here in the West, very much in our heads, thinking, analyzing, figuring things out. And I always would find that I have a broader awareness. It's not even about thinking anymore. It's about a deeper intuitive knowing. I feel like I'm more connected with my spirit, that part of me that's beyond ego, that maybe transcends time, space, lifetimes, realities, and that there's a freedom in that. So often I feel like we can get ourselves boxed in with our minds.
Yeah, absolutely. And sometimes you talk about like the default mode network, that's something what is kind of shut down, and we have access to other parts of our mind, our parts of our being that are normally not as accessible, or we learned to kind of close off from them. So it is this different and expanded experience of ourselves and the world that can happen.
Right. So I want to hear more about if we're, treating people who are coming to us as therapists with, let's say, depression, anxiety, trauma, PTSD, how can these medicines, and we really do consider them medicines, right? How can we use these medicines to help those people heal from those conditions? What have been your experiences with that?
Yeah, and so it's nice you're using the word medicine, because there's like in Western psychiatry, we have medications, and then a lot of the medications are really not aimed for healing. They're used for managing or suppressing symptoms. And these psychedelics have the possibility of actually healing and changing the person so that they no longer need treatment or medication. And we are in a really exciting time, and there's a lot of research happening with MDMA, psilocybin, ayahuasca, DMT, 5-MeO-DMT, ibogaine, and all those are kind of happening, and more people are hearing about that. But the ones we are kind of working with the most and see the most about is MDMA and psilocybin and ketamine. And ketamine is a medicine that is classified as dissociative anesthetic, so it's not a classical psychedelic, but has very high psychedelic properties, and that is currently legally prescribable. And so that is a medicine we can work with. And if we were in this ideal place where all these medicines were available, we, I think, would have better, possibility of being able to see, oh, this person, they're struggling with addiction, and they're, in a pretty good health. Probably working with ibogaine would be something what would help them. Or, somebody's coming with PTSD, and, MDMA would be the way to start, or maybe do a ketamine session and following with MDMA session, so that we would have this freedom to create different treatment plans for people. But that's not where we are right now. And we, how I think about it is that working with the medicine is a part of the treatment. A lot of people hear about these medicines and think about it like a magic bullet. They will have this one experience or couple experiences and things will change. And, sometimes something changes in major way, but oftentimes a lot of the change happens, in the integration sessions, in the sessions that come after, in the long-term ongoing therapy, and that people continue to unfold and understand and work through the things that kind of emerged in the experience. And so the way we work, we really communicate and educate our clients about this, and help them understand that it is this ongoing process. So, for example, with the MDMA clinical trials, we do, 3 90-minute preparation sessions before each experimental session. And then we do 3 90-minute integration sessions. So there is, a lot of about 9 hours of therapy that is done before and after, the experience with the medicine. And then, it continues to unfold. So like in the phase 2 study, they looked at the results in the end of the study, and then they looked at the results 1 year later, and they saw that people continue to improve, in that year when they no longer were receiving MDMA-assisted psychotherapy. And that is that the MDMA allowed them to start look at things that they might not have been able to look at before, or almost like unlocked certain parts of the trauma so that they continue to heal, over time. And so in the same way, when we work with ketamine, we talk about, that it's one of the things the person needs to look at. And if it's their lifestyle, it's, exercise, it's diet, it's nutrition, it's community, personal relationships, oftentimes other medication, and individual therapy, and then the ketamine. So the medicine is one part, and if we only work with that and all these other things are forgotten, people will not have such a good results as they could have.
Right. And the protocols are really just being developed. I have a friend who actually is also one of the therapists on the project in South Carolina. And we actually met a doctor in Charleston who's doing ketamine infusions, but it's not in the context of psychotherapy. It's being delivered as go to the doctor's office, get hooked up to an IV. You're left in a room by yourself. And then, when you're done, they make sure you're okay. And then you go. There's no psychotherapeutic piece where you're getting to process what happened. because maybe you're not going to be talking during your actual experience because you're in this altered state, but afterwards stuff comes up and people don't know what to do with it. And my friend had one of these infusions and had actually a really intense kind of dark shadow stuff come up for her. And I had to facilitate her afterwards in processing it, right? She needed that context.
Oh, so nice that she had you. That is really lucky. Yeah, and so definitely, and that is kind of like what has happened, because ketamine has been approved in 1961 as an anesthetic. So it was, for surgery, and they stopped using it widely because as people were coming out of the surgery, they would have what was called emergence phenomena, that people would come and kind of report on these, psychedelic journeys. But because they were not prepared for it, for a lot of people, it was quite distressing because they didn't understand what was happening. And so they still use it because it's a very safe drug, but they use it oftentimes with other medicines that, like a benzodiazepine that will cause then kind of a memory loss or amnesia on what happened. They still use it with kids, but otherwise it hasn't been used as much. But it became an interest to psychologists and psychiatrists who were interested about this phenomenology and these experiences that people were having. And, in the last, 10 plus years, there has been a lot of research done on the use of ketamine as a medicine to treat depression. And so that's, and then there are a lot of infusion clinics that currently exist that are working kind of what you're describing, where they're trying to use, these lower doses so that a lot of times people will go to more relaxed state, but not have material come up. But, many times they do. And the paradigm of treatment there is really the medicinal paradigm, that they want the medication effect, the antidepressant effect of the medicine. They're looking for symptom reduction. And, there is two other paradigms which I think are, quite different than what we work with, is the psychological paradigm, where the ketamine is the catalyst for the psychotherapy. And then the transpersonal shamanic paradigm, where we're on purpose entering into the psychedelic space when high doses of this medicine are used, and we are inviting this non-ordinary state of consciousness for healing. And so there is this kind of a situation with that I believe that for the psychotherapy, the setting is really important. And there are clients for whom it might be more beneficial to do an infusion, and there are some things that we cannot, deliver in the intramuscular sessions or lozenges, and that is how our physicians work. For example, if somebody has a active suicidal ideation, oftentimes the infusion would be what would be the most helpful. Ketamine as well can be used for treatment of chronic pain. And to do that, you need to use a prolonged infusion, from 3 to up to like 48 hours, where they give these long infusions. And so that has to be done, in a hospital setting. I still would love to see that hospitals and clinics who are using the IV infusion would educate themselves and understand about the possible effects of the ketamine, and encourage people to use soothing music, to use eye shades, so that they would minimize these distressing experiencing, and having somebody there who really understands what it can bring up for people. And so that, like in your friend's situation, that if you were not there, that there would be a psychotherapist, who would be working there, or the nurses would be trained in understanding that things can come up for people and how to support them. Because right now, in a lot of the infusion clinic, when that comes up, they might give them, benzodiazepine, like a medicine to shut it down. And that's, the psychedelics are kind of bringing things up. They're bringing things up for healing. And so we don't want to come and shut it down.
Right. Now, there's another variation I want to talk about here, which is where there's a lot of need right now, because since I think Michael Pollan's book about, microdosing with LSD and Burning Man, and here we are in the Bay Area, and, there's this kind of openness to, experimenting with psychedelics. Well, what's happening is a lot of people are using these drugs recreationally, right, in a different set and setting, and they are having these profound experiences, sometimes upsetting, traumatic stuff is coming up for them, and they don't have, in that party kind of recreational environment, they're not getting that support. So sometimes people are coming to therapists for that integration and processing of those experiences they've had with all kinds of drugs in other environments.
Yeah, absolutely. And so there is a, there's always been people who are using these medicines, and they, are a lot of people who continue to work with these medicines after they were scheduled, and people are more and more interested. And because there is not enough opportunity, people find different ways how they use it. And so I'm always thinking about harm reduction, and that these medicines can be really helpful, and they have potential for, consciousness exploration. And that the way how we look at them now, that like you have to have a mental health diagnosis to be able to receive the medicine. I hope that one day that's not going to be the case. But, to what you're saying, that there is, when people know that they have challenges in their past, that it might be really helpful to optimize the setting as much as they can. And there's a lot of information on how to do that. If it's at least having a friend or having a therapist who is familiar with this type of work and is able to process with them after the sessions what happened or after the experience. And so there is a psychedelic support network where there are lists of therapists who specifically work with people on integration of psychedelic experiences. There are as well trainings, like we at Polaris Insight Center have a training for therapists for ketamine-assisted psychotherapy, but not everyone who comes to our training wants to be a ketamine therapist, but some of them come because they work with clients who receive this treatment, and so want to be familiar and understand what can come up in those experiences. So that for therapists, I would suggest to just listen to the many podcasts that are available, like you're making this one available, and there are many others, and reading books and articles about this, because people are going to be coming into sessions with having these experiences and wanting to integrate that. And there are resources for people who take these medicines recreationally, and really learning about the medicines they're using and what to expect. And and it's kind of like when we talk about a bad trip or bad experience, that, occasionally we could talk about it, but really most of the time in the context how we work, we talk about challenging experience, and that even the most challenging experiences can have the most healing potential. That when there is something difficult happening, we as therapists will provide the most support we can to support the person to move through that and understand that what is coming up for healing, and that the psyche doesn't mostly give us something that's bigger than we can handle. And of course, I'm saying mostly because there are always, exceptions, and they are powerful medicines. And so, there are certain people like with history of psychotic disorders or schizophrenia, that is kind of like a red flag, that there is some potential of bringing some of those things up in the medicine.
Yeah, that was something I wanted to ask you about. Are there people or diagnoses or conditions, for whom this type of therapy may not be maybe contraindicated for them?
Mm-hmm, mm-hmm. Yeah, and so definitely we talk about it, that there are diagnoses like schizophrenia, psychotic disorders. If there is uncontrolled or medicated bipolar disorder, for example, for bipolar disorder, for the depressive side of it, the ketamine can be really helpful, but the person needs to be stabilized so that it doesn't trigger the manic episode. Active substance abuse disorders or, misuse, it's a question. There is people with more of a, stronger personality traits or personality disorders. I would not say that it's contraindicated, but sometimes there is more support needed. So people who have like a big emotional liability, it might be helpful in the context of maybe like a outpatient treatment, so that the person really can get the support, because this medicine can make things more challenging temporarily. That that if we, for example, in trauma, one of the most common ways how to deal with trauma is dissociation and disconnection, and that is something what's really helpful, what helps people to get through their life. But then this medicine, when they open it up and people are starting to look at what happened and heal, there can be time when it feels more challenging. And so that we want people to have enough support to move through that. And I'm in the beginning, I'm saying like kind of cautiously, when we talk about schizophrenia or psychotic episodes, because some people are misdiagnosed, and there are people who have been diagnosed with schizophrenia, and what they've been going through is something called spiritual emergency, where the psyche is trying to heal and reorganize, and that's something again that Stan Grof talked about, and many others. And there was in the Bay Area, there has been even spiritual emergence network. There is still few people, but it's been much bigger in the 70s and 80s, and that so it is a question. So like I worked with a couple clients who have been previously diagnosed with schizophrenia, and it has been several years, but when we really went deep into what was happening, it was clear that it was some of their trauma material that was moving through, and we decided that it felt comfortable with them to work with the medicine, and it actually was really helpful. One of them said that he was able to actually make sense finally of what happened, because when he was having the episode of the spiritual emergence, everything was so fast and so confusing. And so being able to go to actually a similar place with the medicine, with the safe sentencing and support, was something what facilitated almost like healing from the trauma of having that happen. But it's much more complicated to decide here, and so we want to be the most cautious, and so the people who've had those histories will most of the time not be recommended to use these medicines.
Right. I would love to hear more about the MDMA project and how that's going, and tell us more about why MDMA has been, like, why is it so effective for dealing with trauma, with PTSD? Back in the 80s, before they made it illegal, therapists were actually using it in couples therapy. What is it about this drug that can, that makes it so useful for addressing these kinds of issues?
Yeah, and there has been just recently done one couple study that as well was done in Charleston, and it was a phase 2 study. But it is again difficult that when we think from the FDA perspective, like or diagnoses, we cannot diagnose a couple. So this study has been done that one of the people had PTSD and the other one didn't, but both of them received the medicine. So it was a really special study, and I still believe that really it can be so effective for couples therapy, and hopefully one day we'll be able to do that. But it is a beautiful medicine to work with trauma and PTSD. And MDMA has this effect of calming down the amygdala, the part of the brain that's responsible for the fight, flight, and freeze response. And that those are dysregulation, they're responses of the nervous system that in trauma can get dysregulated. So that somebody might be in this state of always be feeling hypervigilant, or being frozen, meaning being depressed, shut down. And it is a way of managing the trauma that has happened. And the medicine kind of calms down this part of the brain, this part of the nervous system. And people, the participants are able to look at what happened, look at the traumatic events in a new way with the support of the medicine, with the support of the therapist, and are able to process the things that they've been through in a new way, in having compassion towards themselves, towards the perpetrators or situations that happened, and actually be able to go into place of healing. And and again, we trust this inner healing intelligence. So we trust that whatever comes up, is what's supposed to come up. And so sometimes somebody comes with, index trauma, why they're in the trial, what they need to work on. And it might not, and in the trial now that people get 3 medicine sessions. And sometimes it might not be until the 3rd session that the trauma comes up, that, it might be like a severe accident that happened. But then as we start working with the medicine, there can be attachment trauma or things that happened in their life, early on. And it's almost like the psyche is like bringing that up, like this needs to heal before we can deal with this other trauma that happened later. So we're, working with the medicine, with what's coming up. And it's so, for that reason, it's a really beautiful way of working and supporting people in healing traumatic experiences.
So yeah, what might a session, so for people who maybe can't quite imagine what a therapeutic, session with this type of medicine would be, what can you describe it to us? Like, what does it look like? What is is the person sitting there talking about their trauma? What's happening in a typical, and I'm sure there's not necessarily a typical session, but what often occurs in a session?
Yeah, and so the first, phase is the preparation phase. So we meet with the person, for psychological testing and assessment, but then for 3 preparation sessions where we are getting to know them. So when we meet for the medicine session, we know them really well. And I say we because we work in co-therapy teams. So their diets, until now, it was mostly male and female diets, but right now they're as well, different male, female, non-binary diets that work with people. And it's really helpful because MDMA session is about, 8 hours long. And so it's really helpful to have a co-therapist there. And it's beautiful to kind of work together as a team with the participant. And so they come in, we talk about their intention for the session, kind of review the way how we're going to work, what we've talked about in the preparation sessions. And, there are some safety procedures of like, safely walking to the bathroom, go through the day. And people are lying down in the session. There, we kind of have a bed or sofa made into a bed. They wear eye shades. So the eye shades kind of invite the internal focus. And then there is a music that we have. We have these special curated playlists that have a specific arc over the time of the 8 hours. So there is kind of like this beginning and then like a more intense music for processing, kind of heart opening music, and then again calming down and kind of ending and settling. So there is this arc of the music that we have prepared. And the participants invited to take the medicine and go inside and see what comes up, and so the session is kind of a combination between inner and outer focus. So we invite the person to go in and notice what's coming up. And sometimes they come and share. And if they don't share for, maybe like 40 minutes, we'll check in with them and see where they are at. And sometimes they talk for a bit. Sometimes they're like, I'm doing well, I want to stay inside. And others feel like they want to share a lot, that they talk, and that, we might then try to invite them to go inside for a bit. It's like, we talked about a lot. There's a lot that came up. Can you go inside for a little bit? And so we go this kind of back and forth with the internal, external focus. And then we, sometimes it looks very similar to talk therapy. Sometimes we do more of a intense processing. We as well work with the body, do somatic work. So, trauma oftentimes trapped in the body, and there is a kind of well-known book called Body Keeps the Score. So, it talks about like the trauma stored in our bodies. And these medicines kind of start to open the possibility of releasing the trauma. And that can look, like shaking or desire to push or some kind of pain or ache. And so we as well will work, with the participant, inviting them to maybe breathe into the area, connect with that, or we will work with them even somatically, like pushing on the place or holding the place, and really following the participant. And so when we talk about the protocols, it's something really interesting to think about psychedelic-assisted therapy and protocols, because protocol is always like, okay, this is prescribed, what we're going to do and what's going to happen. And the way how some of us look at psychedelics is that there is this inner healing intelligence, and that it is an inner directed process. And so I, as a therapist, I can hold, okay, there is this traumatic event, but I don't know if that's going to come up, and I'm not going to direct the session, and I'm allowing for the patient, the participant, to bring up what needs to come up, and then I'm following that. So for the therapist, it's really to learn to kind of hold back and not direct the session, because we might have a tendency to do that. And, and there are some psychedelic assisted therapy schools and schools of thought that, you do bring, you have, you kind of use the medicine to, facilitate certain type of therapy, but that's just a little different philosophy of how that can look like. Mm-hmm. And
Oh, sorry, go ahead.
Yeah, just the only thing I was going to say, that it's kind of, and then, we think about integration. So as the session ends, we might talk about what happened, and, then we meet with the participant the next morning and continue to, talking about what happened. And it's kind of the beginning of the integration process. And the integration process can be for few sessions to, months or even years after the medicine session. So that is the arc of the treatment.
Yeah, and I love that it's so supported, and it's not like come in one time and then we'll never see you again. I mean, I can't even imagine doing this type of deep, profound work in that kind of more medical kind of way, procedure kind of way. So I love that you guys have developed these, even though you're calling them protocols, I think they're incredibly client-centered and really supportive of whatever it is that the client is going through and needing. So I'm curious to hear, before we start to wrap it up, I would love to hear a little bit about the results. What have you guys found so far? You've had some pretty impressive results.
Yeah, so, with the MDMA, we're in the middle of the phase 3 trial, so we have to wait for those results. But in the phase 2, there has been really a huge amount of relief of the PTSD, and it's around, and I don't know the exact number, I think 73 or 76% of people haven't qualified for the PTSD diagnosis, after the trial. So that's huge. And because of that, FDA fast-tracked the research as, gave it a designation of breakthrough therapy, which means that there hasn't been any type of therapy that's been researched, that has this type of success. Oftentimes the breakthrough therapy is given to, medications for cancer and things like that. And so that's been a huge success. And then that's just about 3 years ago. And then this in the beginning of this year, they as well approved a small expanded access program, which means that people outside of the study can actually come and go through the treatment as, just a out of pocket kind of a payment. And so we're very excited about that is happening, and that it's becoming, a little bit closer to becoming available, and their clinical trials now starting in Europe. So that's very exciting, and with ketamine, we work with, depression, anxiety, PTSD, addictions, OCD, and I think that, people who really want to work on what they're coming in for, that the results we see are much better than, for example, just in the infusion clinic, where as well the results that, that are reported are really great, So in the infusion clinics, about 70% of people with depression no longer report depression or have significant decrease after 4 to 6 sessions. But there is this protocol that people have to come back for booster sessions. But when we add the psychotherapy, we see that people don't have to come for the booster sessions at some point. They might in the beginning, but then they get to a place where, they actually feel better, that something got resolved. And so that is, really exciting.
It's so exciting, and it's so encouraging for people who've received these diagnoses and been told, you're going to have this for the rest of your life. You will have this diagnosis, this condition, these symptoms for the rest of your life. And what we're finding with this work is that that's not necessarily true. People can heal from these conditions and no longer necessarily have these recurrent, bouts or episodes. And that to me is really exciting.
Yeah, absolutely.
Oh, thank you, Veronika, so much for being a guest on our show today. If people want to find out more about your work, where can they find you?
Yeah, thanks for having me, Adriana. And so our website is www.polarisinsight.com. And people can as well email me if they have any questions, Veronika, spelled with K, at polarisinsight.com. And we as well provide trainings for psychotherapists. So if people are interested in training, as well, all the information is on our website. And that's the best way, I think. And as well, we have a newsletter. So if people go to our website, they can sign up for our newsletter.
Great. And we will add links to everything we talked about today on the show. We'll have them on the show notes. And I thank you all for tuning in today. Please be sure to like this podcast, comment, share it with others who might be interested. We want to try to get these tools in the hands of more people, providing education, providing information. So please do it, support us in that effort. I'm your host, Dr. Adriana Popescu. Thanks for tuning in, and we'll see you next time on Kaleidoscope of Possibilities. Thank you for joining me for this episode of Kaleidoscope of Possibilities, Alternative Perspectives on Mental Health. This has been Dr. Adriana Popescu. If you enjoyed this episode, please like and subscribe and share with others. To find out more about me, my guests, and more, please visit my website at adrianapopescu.org. See you next time.